At Riverside, we care for our patients throughout their entire health journey and strive to provide remarkable care for our patients, even after they've been discharged from the hospital. We recognize that treatment plans often extend past hospital stays, and setting our patients up to successfully take care of themselves is imperative to the healing process. We've seen it firsthand. Unfortunately, for some patients, healing after leaving the hospital is made difficult or even impossible when returning to less fortunate situations and a lack of accessibility to health remedies, routine hygiene products, and the tools to get well, such as cardiac scales, cast covers, or even heel pillows for our diabetic patients. With your support on this day of giving, we plan to provide post-hospital readiness kits to patients that wouldn't otherwise have access to these products, personalized to their diagnosis and post-hospital circumstances. By equipping our patients with the items they need to properly heal, we are greatly reducing their likelihood for readmission and helping them get well on their way to healing after the hospital.
Daily weight monitoring for our congestive heart failure patients is just as important as daily blood sugar checks is for the diabetic. Providing early recognition for our patients who do report weight gain on the scale has already prevented several emergency room visits for patients as well as inpatient hospital admissions. And what's just as important is for our community to help support our patients who are in need, who cannot afford their own scales, so that they have an improved quality of life and that we can help them get on the right track.
We are going to be able to provide post-discharge care kits for our diabetic patients in an effort to overcome some of the problems that diabetic patients encounter each and every day. And about the diabetic patients sometimes not being able to feel their feet, this also extends around to the backs of the heels. But any kind of pressure over time could break down the skin, and we want to make sure that those heels are floated, is what we call. So they're basically cushioned off of any potential areas that could become abrased and or cause any kind of tissue damage.
This past summer, while on vacation, I broke my foot and was able to experience the Williamsburg Doctors Hospital operating room. Following the surgery, I was looking at how is the best way to keep my cast dry when taking a shower. And I was able to go online and purchase a waterproof cast cover. In the follow-up visit with my surgeon, she said it would be really great if we could get waterproof cast covers to all the patients, especially those who could not afford them.